A lot of people ask the difference between Swedish massage, deep tissue massage, and more medical massage, manual therapy, soft tissue therapy. So there's a lot of different styles out there, and I'm just going to briefly give you an overview of what medical massage is, which is also could be considered manual therapy or soft tissue therapy. Those three therapies are kind of like similar to one another. The other ones are lighter and they're not as detailed. So soft tissue therapy means that when you have an injury in your neck, shoulder, back, ankle, anywhere in the body, there's a certain assessment that you do to figure out what movements are causing the pain, what movement in your life causes the pain or the trouble or the weaknesses, what symptoms do you have. It's more of figuring out, first off, what specifically do you do and what movements bother you that cause you pain or discomfort. Then what you do is there are certain protocols or certain list of things to do. Now, when you're doing manual therapy and soft tissue therapy, you're looking very carefully at, are muscles over-contracted? Are muscles overly stretched? Are they inflamed? You have an eye and a feel. Your hands are like antenna. And what you do is when you're working, you're feeling what's going on. You have knowledge about the tissue and the anatomy, and you know the response that you're getting from the client. And you can figure out how to put it in balance again. So you'd want to relax muscles that are overstretched. You want to lengthen muscles that are overcontracted, but you're not doing just a routine. And that's the difference, is that there's many angles to look at, from when people are lying on their back, when they're lying in side position. You're looking at all the injury, the specific injury in that position, and when they're face down. And sometimes what people do is they say, well, my back hurts only when I stand a long time. So sometimes you need to sit people up on the table at the end or stand them up and do some fine tuning. So a manual therapist or a soft tissue specialist is really looking at all of the angles and has more of a knowledge base about each area that could be injured. And it's really amazing because I have been doing it for over 20 years. And that's what people love. People love to feel when they get up, you reassess them. And when you reassess them and they see that they can turn without pain, they can bend forward, they can raise their arm like they started off here and they can now raise it all the way up. It's because you address those issues. And the last thing I'll tell you about it is that you've got to warm up the tissue and you have to prepare the tissue too. So it's very comprehensive and it's very detailed, and many therapists do not like to do it because it takes a lot of patience and it takes a lot of study and knowledge. So I'm David from LifeRx Wellness, and I'd love to evaluate your case and see how you're doing and see if I can help you. Thank you.